All right, welcome back. This week in Las Vegas, over 1,000 cosmetic surgeons are gathered at the Aesthetic Show to learn about the latest trends in aesthetic medicine. And a new technology is making it possible for men and women to maintain their youthful looks through minimally invasive treatments. Joining us now to talk about those treatments is Dr. Erez Dayan, who is a plastic surgeon out of Reno, visiting us today. Dr. Dayan, welcome in.
Thank you for having me, JJ.
Yeah, great to have you. I've learned so much already talking to you this morning.
Thank you.
Yeah, it's exciting to hear what is on the cutting edge. Radio frequency, the devices we're going to talk about today are all using this technology. What is it exactly and how does it work?
So really, radio frequency is an emerging technology to treat patients in their 40s and 50s who begin to see signs of aging and need something done, but they're not ready or don't want to have excisional traditional operations. So this is really a great way to tighten the skin and improve their appearance.
Great. So it's a minimally invasive alternative to things like facelift, to things like tummy tucks.
Exactly.
This is great. This is a great trend, and I know that the technology in this particular area has really progressed.
Yes.
So today we're going to talk about it.
Yes.
Well, you brought in some devices. These are all made by a company named InMode, and you use them in your office. Accutite is the first device you wanted to talk about.
We use these all the time. This is a bipolar radio frequency device, and the nice thing about this device is it's small, so you can treat areas like the jowls or axillary fat that really bothers a lot of people. And this just goes, this internal cannula goes through a needle stick, and you can heat the tissue appropriately to shrink wrap the tissue.
Interesting. So you're putting the tissue between the heat.
Exactly.
And you're really just getting in there and taking care of things.
Yeah,
wow, that's
and
awesome.
The nice thing about these devices are they have very close safety monitors, so you can measure and control the internal and external temperature to get to the exact temperature you need to get the result you want.
Oh, it's very specific,
very
as I imagine it would be. We're looking at some of the target areas for this Accutite, this first device you've showed us. So you can do some very specific work, can't you?
Yes, great work around the lower eyelids, which really bothers many people. The jowl area is another area. You know, this is perfect for people in their late 40s, early 50s. You know, previously all we had were operations where you'd have to do some kind of excisional procedure like a facelift.
Certainly.
And with new technology, that may not be necessary anymore.
I was very impressed by the results the gal had on her chin, because as we know, this whole sagging neck thing doesn't flatter any of us.
Right.
We don't have it here on the table, but there's also a device called the FaceTite.
Right. So the FaceTite is very similar to the Accutite and BodyTite. It's just an intermediate sized device.
Sure.
And we use it a lot in combination with liposuction, especially for people that have really full necks. You can put this device in and tighten the skin after you remove the fat to really improve the neck contour and give them a really sharp angle of the neck, which improves their youthfulness.
Absolutely. I'm glad you brought that up, because a lot of people are just looking to tighten skin.
Right.
Let's say you're post-baby, or if you've just lost a lot of weight and you think, yes, I finally lost the weight, but now I've got a sagging tummy.
Exactly.
You can help with that.
Well, we're really good in plastic surgery at removing fat, either liposuction or cool sculpting or Kybella. There's many different ways. We focused on fat for a long time.
Sure.
But tightening skin is something we haven't really been good at without removing it until now.
Look at the results she has
This is a patient of mine. This is a 2-week result, and this type of patient, you know, if you just did liposuction, she would probably have a lot of extra hanging skin. And using radio frequency, you can really shrink wrap that skin and give her a beautiful result. Her result was done under local anesthesia in the office. It took about an hour and a half. So you also save on a lot of the expense and recovery of a traditional operation.
Absolutely, because you don't have to pay for the anesthetic and you don't have to worry about the risk of going under. I mean, that's a big thing for a lot of people.
I think so. I mean, general anesthesia is scary to many people, although it's very safe. You know, that loss of control, and people prefer, many people prefer to just have an in-office procedure to improve their appearance.
But you are giving people local anesthetic, so this is not a painful thing for folks.
It's amazing how comfortable patients are. You can do it under local anesthesia. They're completely awake and conversant. And you know, you can liposuction, you can heat, and they do great.
They can participate. If it was me, I'd be like, yes, get in there, get rid of that. Yes. The Morpheus H is another device that you wanted to highlight, because this is doing some incredible things for people.
Morpheus H is an extremely popular device now. These are needles that go through the skin, and this is all under topical anesthesia. And what's different from this and typical microneedling is the radio frequency energy travels from the tip of the needle to the faceplate to tighten the skin and remodel that fat underneath the skin. Sometimes there's just problem areas of the jowl. and you can get these needles under the skin, heat that tissue, melt the fat, and tighten the skin.
So you're mentioning the jowl, and I can see that it's permeating the skin with many different needles. What would be the best area to use the Morpheus H?
So we actually use it all over the body, and we use it in combination sometimes with the Face Tight, AccuTite, Body Tight. It gives you heat from the surface of the skin and allows you heating the tissue from the bottom and from the surface is really a great combination to get the result you want.
Well, this gal looks like she's probably post-treatment because, quite frankly, her body is nice and tight.
Right.
So people can come to you for many different areas. Some people say, hey, help me under the eyes, and while you're at it, you've got to take a look at my salad bags.
Absolutely, absolutely. Well, yeah, the beauty of this technology is it really works head to toe. It works for the periorbital area, jowls, neck, axillary rolls, abdomen. So we really have a lot of experience using it in all different body areas. And the other nice thing is, as opposed to lasers or some other energy-based devices, you can use it on all skin types.
Really?
So, yes, typically patients with darker skin tones, you have to be very careful with heat and lasers because you can change their pigmentation. But these devices are safe to use in them.
That's great to know. It's good. It's good for every skin type.
Right.
The last device you have is called the Body Tighten, and this is a bit larger of a device and better for big areas.
Yep, it's a little longer. It reaches you know, a larger area. And the thing I like most about this is we do a lot of body contouring. You know, mommy makeovers, patients that have had a few kids, they want to have a tummy tuck, liposuction. And this is a great adjunct to tighten those areas of skin that, you know, women who are athletic oftentimes have extra skin in their upper arms. That they're not candidates for an excisional procedure. You wouldn't want to put a long scar on a patient's arm. So this is really a great way to tighten that skin, shrink wrap it in a minimally invasive way.
Dr. Dayan, I'm genuinely enthusiastic about all these possibilities here. We're looking at some before and afters, by the way.
Yes, this is a patient of mine that we did liposuction on with radiofrequency. And I mean, it would be hard to get that amount of skin contraction with just liposuction.
A couple things I would like to know. Is it safe?
It is safe. Of course, when you're using any kind of energy, there's risks of burns. Now, the beautiful thing about this device that I like, as opposed to some other devices, is you have an internal temperature probe, an external temperature probe, and it's all preset. So once you hit those temperatures, if you try to go above them, the machine turns off. So it's actually very safe.
The machine has a built-in safety.
It does.
All these devices are by InMode. If people want to get treated with an InMode device, where do they go?
Yeah, the best thing to do would be to look at the InMode website. They have a list of providers in your area. Everybody's fully trained in the InMode devices, and it's a really exciting emergent technology, similar to how Tesla is, you know, changing the car industry. InMode and radio frequency is really changing the way we do aesthetic surgery.
Awesome. Dr. Erez Dayan, thank you for telling us what is current in radio frequency.
Thank you.
It's very, very exciting. It's so exciting to live in Las Vegas, where we always have people coming into town to tell us about the latest and the greatest. Dr. Dayan is the Faculty and Scientific Advisory Board member of the Aesthetics Show, which is in the Valley right now. To learn more about the treatments he just discussed, visit the website on your screen. InMode is a proud sponsor of the Morning Blend.